Hello friends. Today we are going to discuss about Introduction to International Classification of Disease 11. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I'd like to place this disclaimer. This presentation is for academic and training purpose only. This is not a substitute for professional opinion. For legal opinion, please do contact an advocate. For clinical opinion, please do contact a doctor. Conflict of interest? None. In this video, I'm going to discuss about what is the need of international classification of disease, why should we use this international classification of disease, and the evolution of international classification of disease. In short form, I'll be calling it as ICD. ICD is a globally used diagnostic tool for epidemiology, health management, and clinical purposes, which is managed by World Health Organization with the main aim of comparing the statistics and causes of mortality and morbidity between regions and over time. Basically, International Classification of Disease is a standard which is managed by World Health Organization, which will give a guideline how to make a diagnosis uniformly across the country and across the world. At the same time, since there is a uniformity with regard to mortality, morbidity of illness, we will be able to compare between regions and also with the same region across time. So, as I said, International Classification of Disease by the WHO has different utilities. First and the foremost, to know what are the causes of death, what are the different diagnoses, comparing this between various regions, at the same time, if there is any intervention done, whether the mortality decreased or not. Similarly, to know about the morbidity, that is number of illness, prevalence, incidence, so that we will be able to compare across various regions. At the same time, cancer registry, and recently the phenomena of antimicrobial resistance, that is antibiotic resistance, is coming up very high. Hence, to know about that, the ICD has come up beautifully with regard to that with the standard guidelines. Assessing functionality and disability, here the WHO has come up with Disability Assessment Scale, which is properly known as UDAS. Further, coding the traditional medicines, because all of us believe in allopathy. At the same time, the huge number of population, maybe it in India, US, China, name the country, the traditional medicine is also used by the people. Hence, we need to code for them. At the same time, safety and quality control is also essential, and they are being managed by World Health Organization. Further, by knowing the mortality and morbidity, we will be able to allocate those resources which are very meager, especially in developing countries. Further, we can compare research and clinical trials because of these standard diagnosis guidelines. Further, you'll be able to understand the diseases, whether it is a good outcome in India, whereas it has poor outcome in other countries. Those kind of comparison can be done. Further, we can plan for services. At the same time, management of diseases and also rolling out of guidelines which can be utilized by various countries. And finally, for the insurance and reimbursement, ICD plays a very important role. As you know, across the world, at least 60 to 70% of the population use ICD. Hence, ICD provides a critical knowledge on the extent, cause, and consequences of human diseases and death worldwide via coding uniformly so that the data can be compared across region and also across time. So this is the very important role of ICD. And further, who are using this? ICD is used by doctors, nurses, researchers, medical record department, pharmacists, hospital administrators, policymakers, because the policymakers need to decide where to invest money. Further, insurance companies for reimbursement, to know and to communicate the diagnosis, the ICD plays a very crucial role. Drug companies, device manufacturing companies, health coders, financing, funders, especially for NGOs, biotechnologists, healthcare workers, and many other people who are working in the area of health sector, ICD plays a very crucial role. ICD becomes a single common language to discuss about the health issues within the country, across the country, and in the same country across the time. Let's understand how this ICD evolved. That means historical aspect. The first time what has been documented is Francois Bozoir de Lacroix made the first attempt to classify the disease systematically and published in the title called as Nosolgia Methodica. So this was the first time in the 1706 when he was born, and between 1777 he was able to publish this, and this was the first time it was methodically adopted to classify the disease and also the causes of death. Later, the important landmark issue came is William Farr, who not only made the best possible use of the imperfect classification of diseases available at that time, he labored to secure a better classification and international uniformity in their use. That means he started urging the people need to make a uniform diagnosis so that we can compare the mortality, that is death rates, and also morbidity. Further, the utility of the uniform classification of causes of death was recognized at the International Statistical Congress held in Brussels in 1853. That means in 1853, they recognized, yes, we need to have a uniform diagnostic system so that we can compare between the countries, we can borrow the information from other countries, we can learn from other countries. The Congress requested William Farr and Mark Espine of Geneva to prepare an internationally applicable uniform classification causes of death. So that is the first time the International Congress decided. At the next Congress in Paris, 1855, Farr and Espine submitted two separate lists which were based on very different principles with regard to mortality and the classification of disease. But however, the Congress adopted a combined approach of 139 rubrics. That means they accepted both the Farr's mechanism and also Espine mechanism. Here, they came up with a combined, or what we call it as a mixed approach was adopted. Further, in 1864, this classification was revised in Paris on the basis of Farr's model and was subsequently further revised in 1874, 1880, and in 1886. That means the Williams Farr model became very popular and it was adopted. Although this classification was never universally accepted initially. The general arrangement proposed by Farr, including the principle of classifying the disease by anatomical site, and that survived the basis of international list for the cause of death. That means this was a yardstick which started, although it was not accepted earlier, slowly it became the international standard. In 1893, a French physician, that is Jacques Bertillon, introduced the Bertillon classification of cause of death at a congress of the International Statistical Institute in Chicago. This is the first time he introduced. The Bertillon classification of cause of death, as it was first called, received the general approval and was adopted by several countries as well as by many cities. So, the Bertillon classification played a crucial role. And in 1898, the American Public Health Association recommended the registrars of Canada, Mexico, and United States to adapt it. As for the American Public Health Association, also recommended revising this system every decade so that we can update this classificator system. As a result, the first international conference to revise the international classification of cause of death took place in 1990, with revision occurring every 10 years thereafter. In fact, the next congress or the conference was held in 1909, and the government of France called the succeeding conferences in 1920. That is the third conference, 1929 fourth conference, and the fifth was 1938. At the same time, if you know, there was a First World War and the Second World War. At the end of the First World War, the League of Nations were formed. These League of Nations were also interested in the health-related issues. Hence, the Health Organization of the League of Nations had also taken an active interest in this health statistics. And an equal number of representatives from the International Statistical Institute and the Health Organization of the League of Nations came together. And the mixed commission drafted the proposal of fourth and the fifth revision of the international list of cause of death, that is in 1929 and 1938. That means, although it was the part of International Statistical Institute, now the League of Nations started entering into this. The 5 revisions that followed contained only a minor revision. The 6th revision became a landmark. The reason being is the International Health Conference held in New York in 1946 entrusted the Interim Commission to the World Health Organization. The ICD was born. That means the League of Nations took over this and formed a World Health Organization, which was born in 1948, took up this, and from that day onwards, the ICD has been given an important responsibility under WHO to be released every year for the standard classification of disease, mortality, morbidity, disability. The International Conference for the sixth revision of the International List of Diseases and Cause of Death was convened in Paris in 1948 by the government of France. The conference approved the international community to adopt uniform medical certificate for cause of death to be coded. This was the first time even the World Health Organization under the League of Nations started this. And this League of Nations became United Nations. And this United Nations came up with uniformity of how to declare the death, that is medical certificate for death, or what we call it as death certificate, is being uniformly recorded across the world. In 1948, the first World Health Assembly endorsed the following things. That is the report of 6th revision of ICD, uniform death certificate, and also compiling morbidity and mortality statistics in accordance with the International Statistical Classification of Disease for the members of UN. Here, the United Nations, whoever were the members, started accepting the World Health Organization, uniform death certificate, and also a disease classification which was endorsed by World Health Organization. Hence, ICD-6 came in, and that is the Manual of International Statistical Classification of Disease of Injuries and Causes of Death. The manual consists of 2 volumes. Volume 2 being an alphabetical index of diagnostic terms coded to the appropriate categories. And subsequent revisions were 7th and 8th. The 7th revision took place in 1955 in the conference which was held in Paris, and the 8th revision took place in Geneva in 1965. Further, the 9th revision and 10th revision. 9th revision occurred in 1975 and 10th revision in 1989, and the ICD-10 came into picture in 1992, which was a landmark. Now the current is ICD-11. The all member state approved implementing of ICD-11 in the 72nd meeting of the World Health Assembly in 2019, and hence on the 1st of January 2002, ICD-11 was released with the aim of better health with better information. This table clearly talks about the summarizing the various ICD edition from 1st to 10th. The first was in 1900, and the second conference which took place in 1909, and the release which occurred, third, fourth. You can see how they have been released, and in the third column you can see when the year in the US mortality was accepted, and further ICD clinical modification of morbidity which was started taking place in 8th, and finally here in the use of US. So these are the various ways, the landmark timeline which has been depicted here. And summarizing, you can see the ICD from 1 to 11, what are the timeline when they have been released. Now let's discuss about ICD-11. This is the common standard for a connected world with regard to health. That means if I'm discussing about ICD-11, and if I say COVID-19 infection, and if I say this is the variant I'm talking about, beta variant, epsilon variant, or any other variant, if I'm discussing, this has to be defined prior, and it will be defined by the WHO, so that we can recognize the variant and we will be able to understand which vaccine will be effective against this variant. That a uniformity was brought by World Health Organization. So ICD-11 includes 26 chapters. 2 supplementary sections have been added. Those are section 5 and section X. Here, supplementary section for functional assessment. That means it talks about disability assessment and functional assessment. For the purpose of disability, WUDAS has been used. Section X include extension codes. With regard to these extension codes may be related to the severity of illness, mild, moderate, severe, or the course of illness, episodic, subacute, or else maybe chronic course, onset, acute, abrupt, chronic, insidious onset, the timeline, when the illness started, Diagnosis certainty, that means whether it is a provisional diagnosis, differential diagnosis, or confirmed diagnosis. At the same time, diagnosis timing, these are considered under Section X. And now, the ICD-11 also introduced certain important new chapters. Those chapters are Chapter 3, Disorders of Blood and Blood Forming Organs. That is one, the new chapter has been added with modification. Chapter 4, Disorders of Immune System. Chapter 7, Sleep-wake disorders. That is, sleep disorders have been, a separate dedicated chapter has been given. At the same time, Chapter 17 talks about sexual health. Here, even the transgender or gender non-conformity also been added here. And these have been removed out from the mental health and brought into a separate Chapter 17. Chapter 21 talks about the symptom signs or clinical findings not elsewhere classified. You may find certain symptoms which do not fall into any category and a new symptom has arrived that will be coded under Chapter 21. Chapter 26 is a landmark. That is, traditional medicine coding has been invited and has been accepted by World Health Organization. If you look at the ICD-11 highlights, it is the 11th revision contains 17,000 unique codes, more than 120,000 codable terms. The whole ICD-11 is entirely digital. Smart coding algorithms have been taken and now interprets more than 1.9 million terms. And it is the state-of-the-art coding tool. That means it becomes easier, but you need to know how to operate this system. And if you look at the ICD-11, you'll be able to understand the various dimensions of ICD-11. Let's look into each one of these dimensions. The dimensions talks about mortality, that is cause of death. It also talks about the primary care. Separate classification has been introduced. Cancer registration, patient safety, dermatology, pain documentation, allergology, reimbursement, clinical documentation, data dictionary for WHO guidelines, digital documentation of COVID-19 vaccination and status, and test results and more. So these have been included under ICD-11. Further, conceptual framework of independent of language and culture. That means ICD-11 is moving out of the language and the cultural concept. Integration of terminology and classification has been brought in. End-to-end digital solution. API, tools, online and offline availability has been made. ICD-11 is accessible to everybody. And it is an open course or open source has been considered. It is considered as open ICD-11 license. It is distributed under Creative Commons Attribution, no derivatives, that is 3.0 IGO license. That means it is free to share, copy, and redistribute. But one need to give attribution to the WHO. That means you must give appropriate credit. And it should be non-commercial and no derivatives. That means you are not going to make any edit to the ICD-11 without the prior permission, and you will not be selling it for the purpose of commercial gain. ICD-11 enables for the first time the counting of traditional medicine encounters, and also it is up-to-date scientific knowledge. Codes for antimicrobial resistance has been brought in, and it is considered as GLASS. GLASS means Global Antimicrobial Resistance and Use Surveillance System. Here, the World Health Organization is very clear. We need to keep the surveillance with regard to antimicrobial resistant bacteria need to be kept into check so that we will be able to monitor it closely. Codes for full documentation of patient safety in line with the WHO patient safety framework has been brought under ICD-11. Integration of functioning and intervention is also brought in. Here ICF, that is International Classification of Functioning, Disability and Health, that is ICF. Further, International Classification of Health Intervention is also brought in here. Local deployment option for ICD with API, Docker, Windows, Linux services have been enabled. Implementation package to facilitate the transition from ICD-10 to ICD-11 has been brought in. To conclude, my dear friends, ICD-11 allows the systematic recording, reporting, analyzing, interpretation, and comparison of mortality and morbidity. And the collected data will be used to compare between different countries or regions and across time and at the same time. Further, ICD-11 ensures semantic interoperability and reusability of recorded data for the different use cases beyond mere health statistics, including decision support, resource allocation, reimbursement, guidelines, and much more. And my dear friends, ICD 11 has brought in a single common language of understanding between health sector, that is, between one country to another country and within a country across the states. So if I'm able to tell schizophrenia, the other person is able to understand I'm talking about the WHO standard of ICD 11 schizophrenia. So he will be able to know what I'm speaking. And if I do any clinical trial with schizophrenia, he'll be able to know what is the diagnosis and what are the terms I am using it. So the uniformity is there across the world. And that is ICD 11, my dear friends. So ICD 11 has played a crucial role, and it's going to play a crucial role in the near future also. So, my dear friends, please look into ICD 11 and learn more about it. Thank you very much for giving your valuable time. Stay safe.